Good evening. For this discussion, should I say good day rather? Sorry. For this discussion, we will be talking about the peripheral vascular diseases. Again, let me remind you, our concept this preliminary period is all about oxygenation. So we are dealing with problems pertaining to the flow of the blood, to the delivery of oxygen to the cells, the intake of oxygen in the body. So that's why we have started off with cardio. Okay, so that the concept was fully discussed by Dr. Areglo. And then we still have respite, so that's cardiopulmonary. Again, it'll be discussed partly by Dr. Areglo and partly by me. And then we will have this peripheral vascular diseases. And also another one will be hematologic diseases. So if you can see, we are really dealing with blood circulation and oxygenation in general. Okay, so that's our general concept. Now, for tonight, for this video, we will be dealing with the blood flow to the periphery. So we are dealing with the extremities. Okay, so just an overview of the anatomy and physiology. So we are dealing with the blood vessels. Okay, so remember how many blood vessels or how many types of blood vessels do we have? So what are the major types of blood vessels? Anyone? Okay, so if your answers are, or if your answer is three, then you are correct. Definitely, what are those three? So we have our vein, our artery, and our capillary. Now, anatomically speaking, okay, the vein and artery would have similarities, and capillaries are really, well, it's quite different because veins and capillary, or veins and artery rather, they are passageway of blood, while capillaries, the function is to allow the transfer of gases, nutrients, and all. So that's why capillaries is anatomically different from veins and arteries. Now, what is the main difference? So basically, our vein and artery has three layers. Okay, so we have three layers. You have your tunica intima. Okay, let me just, we have tunica intima. We also have tunica media, and we also have tunica externa. So these are the three layers of our veins and arteries. Now, as I have mentioned, veins and arteries are quite similar, pero definitely there are also some forms of differences. Okay, so this is an image, and I think you're already familiar with this. Okay, it has been discussed in anatomy and physiology. But again, just to review, so our tunica intima is the innermost layer of our vein and artery. So that's basically the lining, the inner lining of our veins and artery. And well, if you can see that the tunica intima of the artery is just straight, while the tunica intima of our vein has what we call as these valves, okay? Because again, the blood flow inside the artery is different from the blood flow inside the vein. The blood flow inside the artery flows on a high pressure environment, while there is very low pressure in the vein. Because blood flow in the artery is brought about by the pumping action of the heart, and the blood flow in the vein, it's just way away from the heart. So definitely the pressure is very low. So that's why the purpose of the valve is to push the blood upwards through muscle movement. Okay, through muscle movement. So ibig sabihin, pag nag-contract yung muscles, it will push the blood upwards, and the valve will avoid regurgitation. So it will avoid the backflow. I think that's the best word. It will avoid the backflow of the blood down there. Now, this is very significant because as we discuss our topics now, this is one important thing that we have to consider when it comes to peripheral vascular diseases. On the other hand, as I have mentioned, sa artery naman, di ba nga high pressure naman yung flow niyan. And also, the blood in the arteries are oxygenated. So that's why, again, if we want to know if the problem is with the vein or with the artery, it will have differences. Okay, we can actually differentiate problems with artery to that of the problems with the vein. Another difference among the three layers, of course, the characteristic of the tunica media. Sabi ko uli kanina, when we talk about the artery, the blood flow, or rather, the blood flows in high pressure environment. And for the vessel, okay, to manage that increase in pressure, syempre, it requires support. Okay, so that's why if you can see, the tunica media of our artery is way thicker than that of our vein. Okay, now the tunica media of the vein is thinner than the artery. Again, low pressure environment. Now, in tunica externa, they are both flexible. They are both, shall we say, pliable, okay? So, it's all made up of collagen fibers, okay? So, again, there may be some differences, there may be some similarities, but we will also remember what are the functions of each. So, again, tandaan, artery, passage of blood from the away from the heart. Okay, that's basically what we always remember, away from the heart, while the blood in the vein flows back to the heart. Okay, so yun. Now, as sabi ko rin kanina, di ba, we have three types of our blood vessel. You have the artery, you have the vein, and the third is our capillary. Okay. Okay, so we also have our capillary. Now, capillary naman, tandaan natin, it's just one layer thick, okay? Because again, the capillary would allow the transfer of these gases, hormones, to and from the cells, okay? So, yun. Now, the other things, familiar na kayo dyan? So, sabi ko nga, may mga differences, and I think we have already discussed this. This is how the blood flows in the vein. Okay, sabi ko sa artery, the blood is being pushed by the pumping action of the heart. In the vein, the blood is being pushed back to the heart by means of skeletal muscle contraction. So you have parang it's like it's being milked upwards, okay, if it's from the lower extremities. So definitely when the muscles contract, di ba? When the muscles contract, it will squeeze the blood vessel, okay? In this case, the vein, it will squeeze the vein, and that will push the blood upwards, and the valve, okay? So the valve here, there, it allows one-way flow of blood. So again, it avoids backflow. So it's making sure na lahat ng blood paakyat papunta sa heart. Okay, hindi pa maayos yung heart. Okay. Sabi mo parang, I think it's with the screen. Basag na kasi yung screen, niya. So, yan. Okay, it flows back to the heart. Okay? So, yun. Again, capillary, sabi ko nga, it only has one cell layer. Okay, why? Because it allows the exchange of gases. Okay, it's very self-explanatory. Okay, so capillaries form what we call as the capillary beds. And remember, this is where the blood flows from the artery going into the vein. So this is where the blood exchange happens. Okay, so the gas exchange happens. This is where the waste products goes into the blood and so on, and the nourishment would go to the cells. So all of the transfers, all of the waste coming out of the cell and the nutrients coming into the cell, it all happens through the capillaries. Okay? There. So this is how it flows. So again, you have the terminal arteriole. So this is the end of the artery. Now it goes into the microcirculation in our capillary bed, and then it goes back to the heart through our vein, which will then again bring it to the heart for oxygenation, and the process will continue. Okay, there. Let's also be familiar with the different or with the major blood vessels. Of course, with the artery, so we are pertaining to the aorta. Our aorta has 4 major branches. You have the ascending aorta, ascending pataas. So this is our ascending aorta. I know you can't see it. Okay, kasi nakaharang dyan yung shall we say, yung video. Okay? Yung mukha ko nakaharang. Okay. So, I am trying to see, pero wala. Basta, you can see naman, di ba, the aorta, pag ganun siya. So, this is our ascending aorta. Okay, papataas kasi. Ascend. Okay. And then, of course, you have here the arc. That's your aortic arc, which has 3. It has, pangit ang drawing ko, no? It has 3 branches. Okay, you have your brachiocephalic artery, you have your left common carotid artery, and you have your left subclavian artery. And then you have the thoracic aorta. Okay, it's not an arc, it's thoracic aorta. Okay, we'll get back to this later. Okay, so this is our thoracic aorta. So from the term itself, so it supplies blood to the thoracic vessels. Okay. Then of course we have our abdominal aorta, which is the longest and technically the biggest of all regions of the aorta. So we have the abdominal aorta, okay, that gives way to the renal artery, your hepatic artery, your mesenteric artery, so that's with the intestines. And of course, you have your iliac, okay? So there are so many branches of our abdominal aorta. And of course, you have the blood flow to the lower extremity. Okay? So on the end of our veins naman, so of course, we have the major veins. You have your inferior vena cava and your superior vena cava. So we know that our inferior vena cava drains the blood from the abdomen. Okay? So the gonads, the lower extremity. Then you have the superior vena cava. Parang nabablanko, no? The superior vena cava, which is responsible naman for the blood flow from the head, okay, from the arms, the upper extremity, going back to the heart. Okay, so this is significant as we go through our discussion. Now, let's talk about the first condition on blood vessel, and I think you are familiar with this. Okay, so we have what we call as aneurysm. Have you heard of aneurysm? Or did you know someone who died of aneurysm? Diba? They say that aneurysm is also a form of silent killer. Sometimes they don't know that there is already aneurysm. They would know it already kapag nag-burst na siya. Okay? So, well, aneurysm as in all forms, basta kapag sinabi natin mga vessels and aneurysm, this is usually characterized as the localized dilation of an artery. So, the artery is permanently dilated. Ibig sabihin, if this is the typical circumference of the artery, if there is aneurysm, there will be bigger circumference of the artery. Okay, so it enlarges the artery up to twice its normal diameter. So again, just imagine if this is just the normal diameter of the artery, dodoblehin niya, lalaki siya. Okay, ma'am, is it not a problem? Let's go back. What do you think will happen if it's stretched? Diba? Well, just take, for example, a balloon. Diba? So, kapag na-stretch ang balloon, meron siyang threshold. At a certain volume of air inside, magbe-burst siya. So, that's one thing that we would like to avoid in aneurysm. Yes, it's just dilation, di ba? Parang, well, nag-dilate lang naman. But come to think of it, if it's dilated, then so the cell walls are stretched. And again, it has limits. It cannot stretch as much as needed. Okay, there is only a certain limit or threshold. And that's, again, what we want to avoid. Now, going back to our discussion, when we talk of aneurysm, there are actually different types of aneurysms. It's not just about it being dilated. There are different presentations of aneurysm. First, we have the fusiform. Okay, pag sinabi natin fusiform, it affects the entire circumference of the artery. Ibig sabihin, if this is the artery, may ganyan siya, yan yung normal diameter. Kapag fusiform, lumaki siya ng buo. Now, these are the images just for you to have an idea. Kasi baka nabobore na kayo sa drawing ko. Okay? So, this is a fusiform aneurysm. So, as you can see, the diameter of the artery is stretched on its entire circumference. Well, the next, we have the saccular aneurysm. Ay, sorry. Okay. Next, we have the saccular aneurysm. Now, pag sinabi natin saccular, so you have the term sac. Okay, why? Because it forms a sac. Diba? Parang hindi niya affected yung buong circumference. It only affects one certain area of the blood vessel. And it forms, again, a sac. Okay, so the third one, well, it can happen to both. Okay, it can happen to both. Kaya nga sa iba, if you look at the types, it's just fusiform and saccular. Okay, kaya lang for some, sinasama nila yung ruptured. Kasi pag sinabi ng ruptured, there is impaired integrity na of the blood vessel. The blood vessel has already ruptured or nag-burst out na siya. Okay, so it's no longer intact. Okay, it's no longer intact. So definitely, what would you observe? So if there is ruptured aneurysm, there will be profuse bleeding in that area. And ano uli ang nagdilate dito? Is it the vein or the artery? Ang nagdadilate sa aneurysm is an artery. And what does the artery carry? It carries oxygenated blood. So just imagine, if these types of aneurysm suddenly ruptures, it will deplete the next, the nearest organs, okay, because they won't be delivered with enough blood to meet their demands. Okay, so that's the reason why aneurysm can be fatal. Okay, aneurysm basta kapag nag-rupture na siya, the chances of fatality is very high. Okay, so please put that in mind. Okay, next. So remember that aneurysm would always tend to be at a specific anatomic site. Okay, usually yung kumbaga yung weakest area, mabilis siyang mag-pouch doon. But the most common is the abdominal aorta. Okay? The most common site of aneurysm is abdominal aorta. And yun nga yung common presentation. But again, it can happen in different areas. It can be on the ascending aorta. It could be on the aortic arc. It could be on your subclavian artery. It could be with the abdominal aorta. Of course, you have your dito sa may tawag dito, branch. So you have your left, your right iliac artery. So lahat yan pwedeng magkaroon ng aneurysm. Okay? Lahat ng artery pwedeng magkaroon ng aneurysm. Well, lalo na kapag nag-discuss na kayo ng neuro, so it can also happen in cerebral artery. However, for today's discussion, we will focus more on the abdominal aorta, which is again the most common site of aortic aneurysm. Okay? So this is a normal aorta, and this is the aorta with a large abdominal aneurysm. So just imagine, di ba, ganito lang siya dati, ganito siya ngayon. So just just think of how thin the walls would be. So at any point, you know that this can suddenly rupture. What will happen kapag nag-rupture to? So the blood will be pulled inside the abdomen. At the same time, the blood will not flow properly on the other organs. And in this case, if it's abdominal aneurysm, so it will deplete and affect the blood flow in the lower extremity. Okay, and then it will cause bleeding within the abdominal cavity. And we know that any forms of bleeding can also pose a great risk for the health of our client. Okay. Remember that aneurysm usually forms, okay, when the tunica media, sabi ko naman sa inyo, mahalaga yung anatomy, di ba? When the tunica media weakened, among the 3 layers kanina, if you can remember my discussion, di ba, ang pinaka-support, okay, doon sa 3 layers na yon, yung pinaka nag-act as support ng vessel, it's actually the tunica media. Diba? That's why the tunica media of the artery is much thicker as compared to the vein, because the demands within the artery is very high, because again, the blood there is flowing in a high pressure environment. So again, aneurysm can happen initially when the middle layer is quite weak. Okay, kapag very weak, syempre hindi na niya kayang isupport, then that will stretch the inner layer, that will stretch the outer layer. And again, there is only a specific threshold. Okay, meron lang yang kayang ilaki. Di ba? Parang yung mga balloons, may mga sizes siya. So kapag hinipan mo siya more than what is expected, it will burst out. The same goes for our artery. If there is so much pressure inside than what it can handle, definitely it can also rupture. And again, arterial rupture is quite life-threatening. Okay? Yeah. Now, what's the usual cause of aneurysm? So the most common cause of aneurysm is atherosclerosis. Okay? And of course, most especially among clients with hypertension and those who are smoking cigarette. This is a huge contributing factor in the development of aneurysm. Why? Because definitely if the walls are not healthy, if the walls have problems, if anatomically may problema sa walls ng vessel, then the chances of rupture, the chances of weakening is very much likely. Okay? So yun. How would we know if our patient actually presents signs of aneurysm? Sabi nga natin, di ba, there may not be significant symptom na, ay, kapag ganito yung naramdaman, it is aneurysm. So, syempre, we have to base it on sets of manifestations. So, sabi nga, silent lang yan. Most of the clients are asymptomatic. Most of the clients are asymptomatic. Wala silang masyadong mararamdaman. Pwedeng may iba silang nararamdaman, nagpa-check up lang sila, saka lang nila makikita. Okay? Because, ayan. Sorry. Okay, kasi nga, pwedeng initially habang lumalaki siya, wala kang nararamdaman. Now, usually the pain is associated if sobrang laki na niya. If it already squeezes the other organs. And again, the most common is abdominal aorta. So our clients may experience abdominal pain, flank pain, back pain. If it's why? Kasi di ba nasa ng abdominal aorta, nandun siya sa loob. So kapag siya ay lumaki, twice its diameter, maiipit niya, maapektuhan niya malapit kay kidney, malapit kay liver, okay? So, the pain is present and pwede pa ngang iba-ibang parts, okay? Depende sa yung nararamdaman niyang pain? Well, it stimulates the stimulators, okay, of these different organs. Now, if nag-rupture na siya, okay, if the AAA, abdominal aortic aneurysm, okay, kapag yan ay nag-rupture na, siyempre there is increased bleeding. What will happen kapag nagbi-bleed? So there is hypotension, di ba? Bumabagsak ang fluid volume. So there can be diaphoresis. Of course, mental obtundation. Why? Because the oxygen or the blood is not enough to be pumped into the different parts of the body, most especially in the head. Okay, so you have mental obtundation. Pag sinabing mental obtundation, yun nga, parang bumababa yung LOC niya. Okay, so yun. Or hindi lang parang bumababa talaga yung LOC niya or level of consciousness. Then you also have oliguria. Again, the fluid volume is quite deficient now because the blood is being pumped out of the vessel. And nasaan lang yan? Nasa aorta pa yan. So the pressure is very high. Okay, so you also have dysrhythmias. Again, these are signs of hypovolemic shock. Okay, why? It can only indicate that there is an existing bleeding. And syempre, if physically hindi mo makita kung saan nagbe-bleed, so you suspect that there will be bleeding inside. And in this case, it could be because of ruptured abdominal aortic aneurysm. Okay? Now, what are the diagnostic tests? Now, what you can see on the screen, tingnan nyo nga, what are we pointing here? Yan, di ba? Normally, may kanya ka bang makikita sa x-ray? Wala. Okay? That's one clear appearance of AAA. Okay? There is the eggshell appearance. Parang merong itlog. Bakit? Kasi nga, nag-pouch yung iyong ano. So, there will be a clear outline of the blood vessel. Okay? Now, another, okay, ito yung usually preferred. Okay? Kapag alam naman natin we are dealing with aneurysm, this is what we usually prefer. This is CT scan. Why? Because apart from telling you, it will give you a better understanding of what the size of the aneurysm is, 'di ba? Kasi kapag kasi X-ray, it's very very two-dimensional, okay? Very flat. Yan lang makita mo. If you want to investigate further, so you can look at different planes, 'di ba? Titingnan mo different planes niyan. Now, this will help us determine the size and the exact location of our aneurysm. So it's not just like X-ray na, ay, merong ganyan. Pero hindi ka rin sigurado ano ba talaga siya. Now, the most definitive is, again, CT scan. Okay? Now, other diagnostic tests would include ultrasonography. This is how it looks like. Nakikita nyo? Diba? Hindi naman siya buntis, pero i-ultrasound natin. Why? Because the sound wave will actually affect ito. So you will have an outline of how the what's the characteristic of our AAA. Okay, so it will provide accurate diagnosis, and also it will help us identify the exact size, the exact location of our aortic aneurysm. Now, what can we do, okay, to manage aneurysm? Now, nakita nyo naman dyan, di ba? So, syempre, kung na-compromise na yung wall, what we do is we put a graft on it. So, the procedure, first pala muna, okay, non-surgical. Syempre, pwede hindi ka muna mag-opera. So, bawasan ng pressure. So, kaya pwede rin kaya nagkakaroon ng aneurysm kasi sobrang taas ng pressure, di ba? So, babaan ng pressure by maintaining blood pressure at normal level. It decreases the chances of rupture, okay? And it can easily be managed by an antihypertensive drug. Okay? Then, syempre, other intervention, dapat alam mo kung lumalaki na siya. alam mo dapat yung size niya. So you can prepare for impending rupture. There. Okay. Surgical management, that's what you can see on the screen. So we can do abdominal aortic aneurysm resection. So may part ng aneurysm na tatanggalin, then i-repair siya. So ibabalik siya sa dati niyang diameter. And usually ginagamitan ng mga prosthesis yan. Okay, para siguradong hindi na siya mag-expand ulit. Okay? So yun. Okay? Next, we have the other peripheral vascular diseases. Okay, ma'am, hindi pa ba yun? Oh? Kasi nandun pa siya sa aorta. Now, we will be dealing more with arteries and veins. Now, when we talk of peripheral vascular diseases, tandaan, these are the disorders that alters the natural flow of blood through our arteries and the veins of the peripheral circulation. Now, the most frequently affected, kasi nga, periphery nga, so the most frequently affected are our lower extremities, okay, as compared to upper extremities. Okay, bakit? Kasi by gravity, mas mahirap mag-flow ang blood paakyat. By gravity, mas mabilis flow ang dugo pababa. Okay, so kaya the most common site of peripheral vascular diseases are the lower extremity. So the leg, the foot. Okay, so dyan natin siya usually makikita. Okay. Now, what is the general pathophysiology of these peripheral vascular diseases? Okay. So first, it could be because of pump failure. It could also be because of vessel alteration. It can also be because of circulatory insufficiency. Now, let's talk about each of these one by one. Now, when we talk of pump failure, it could be because of inadequate blood flow. Nagkaroon ka ng PVD kasi hindi maka-flow ng maigi yung blood dun sa site. Sounds good, di ba? Sounds possible. Okay? Now, it could also be left-sided heart failure. It could be because of pulmonary congestion. It could also be right-sided heart failure or systemic circulation. Okay. Now, on the other hand, problems with the blood vessel, it could be because of trauma. Yes, trauma in the blood vessels can cause peripheral vascular disorders. Then, of course, we have atherosclerosis and arteriosclerosis. Okay, and I think you have discussed this also already. Sa circulatory insufficiency, when we talk of insufficiency, it's not enough. It could be problems with the arteries. So there is arterial insufficiency, hindi enough yung blood na na-flow doon ni artery. Or it could be venous insufficiency. Ibig sabihin, the veins can't push the blood back to the heart. Okay, so again, both of them, there will be problem when it comes to them carrying out their responsibility. Now, all of these three conditions can actually lead to inadequate blood flow. Now, what do we mean by inadequate blood flow? Siyempre nga, di ba, hindi nagpo-flow ng maigi yung blood. So, ibig sabihin, may mga parts ng katawan na hindi nagkakaroon, na hindi nabibigyan ng chance na makatanggap ng oxygenated blood at makapaglabas ng kanilang waste products, no? So, inadequate blood flow can actually lead to ischemia. Ischemia is a state of low oxygen level. Okay? And ischemia, if not properly managed, di ba sabi nga natin, mababa ang oxygen carrying capacity or yung oxygen supply mababa, kaya nagkakaroon ng ischemia. So, kapag tumagal ng tumagal yan, it can actually lead to cellular necrosis or cell death. Why? Because in the absence of blood, ano bang dala ng blood? You have oxygen, you have nutrients, you have different hormones, you have neurotransmitters, kung ano yung kailangan niya. Diba? So, since wala, mamamatay na siya. So, that's why it can lead to cellular necrosis. Okay? So that's PVD. Now let's discuss other concepts, okay, pertaining to that. First, let's talk about circulatory insufficiency. Now, when we say circulatory insufficiency, again, there is not enough blood on the area, or let's say that's in the form of the artery. So the blood is not properly delivered into the different parts of the body, okay? Meron din naman tayong tinatawag na venous insufficiency. So ibig sabihin, the vein is not capable of pushing the blood back to the heart. That's the main responsibility of the vein. It's for it to make sure that the blood that passes through it goes back to the heart well. Okay? So let's talk about arterial insufficiency and venous insufficiency. Now, again, ma'am, pareho lang yan, okay? Hindi, okay? So there are differences. Now, this table will actually show us the difference between arterial insufficiency and venous insufficiency. Because definitely, if the problem is the artery, it would require different management. If the problem is the vein, it would require different management. Okay, so there are things that we have to consider. That's why we must know whether it is arterial or venous insufficiency. Now, let's start first with pain. Okay, clients with arterial insufficiency experiences what we call as intermittent claudication. When we say intermittent claudication, this is when there is muscle pain that happens when they are active, or when they are walking, or maybe having an exercise or running, masakit siya. There is muscle pain on the lower extremities. Okay. However, when you stop and rest, the pain is gone. So in short, the pain is only associated for any muscular actions. Okay, skeletal muscle action. Okay? So yun, that's intermittent claudication. Now, for venous insufficiency, do they have that? Actually, they don't. Okay? They don't have intermittent claudication. But there is continuous aching and cramping. Ibig sabihin, with or without activities. With or without movement, there will always be pain and there will always be cramping. Okay, that's one significant difference between arterial and venous insufficiency. Another item is the pulse. For arterial insufficiency, tandaan, ano ba ang mini-measure natin sa pulse? What we are measuring is the blood flow inside the artery, di ba? Kaya ang ina-assess natin, that's the radial artery, it is the brachiocephalic artery, di ba? When you want to see if the patient's still alive, you have to check the carotid artery, okay? Because pulses are generated, okay, in the artery and not in the vein. So kaya, if it's arterial insufficiency, now you may experience diminished or absent pulse. In most cases, diminished. Okay? Sabihin, sobrang hina. Okay? Sobrang hirap niyang i-count. Okay? Now, for venous insufficiency, ayan, pulse is present. Okay? There's no problem with the pulse. Okay? The pulse is present. However, it could be very difficult to assess. Why? Because it's usually edematous. Okay? So, if it's edematous, okay, may edema, manas siya, so mahirap i-feel yung pulse. Okay? Kaya i-identify mo yon. Kapag hindi mo ma-feel, hindi mo ma-count, then you have to take note that the patient has edema. Okay? Skin. Yan. Clients with arterial insufficiency usually manifest dependent rubor. What do we mean by dependent rubor? Ibig sabihin, there is redness of whatever extremity is dependent, or it's below the heart. Okay? So usually yun. This is how it looks like. So kaya you can see this problem, yung dependent rubor, kadalasan nakatayo yung pasyente, din yung paa niya sobrang mas mapula or red. Okay? Or Naka-sideline siya, then that area, iba yung color dun sa upper part ng katawan. Okay? Kasi mabilis mag-pump yung heart doon. Then venous insufficiency naman, the problem with the skin, there is increased pigmentation in the goiter area. This is the goiter area. Okay, let me just, and that's the goiter area. Okay. So, dyan usually nakikita nyo meron siyang mga, di ba, mga problem sa skin. Okay, so yan, venous insufficiency. Next. Okay. Now, if there are ulcers naman, ulcerations, okay, in short, nagkaroon na ng sugat. Nasugat na siya, okay, because of what is happening. Now, again, if it's arterial insufficiency, iba yung itsura niya sa venous insufficiency. First, let's talk about the location. Sa arterial, ang most common site ng ulceration or mga sugat-sugat are the pressure areas. And again, we are dealing with the lower extremity. Okay? So, yan. It's usually the pressure area. So, you have the tips of the toes and then the heels. Okay? Yan ang madalas na nagkakaroon ng problem. Okay? Nagkakaroon ng sugat. Another is, yan, kapag venous naman, again, ano yung tawag natin kanina dun sa area? Okay, that's the goiter area. Okay, so if we are looking into the anatomical term, we are referring to the medial malleolus, lateral malleolus, and anterior tibial area. Okay, so that's the goiter area. Okay, so what I have shown you earlier. Another, let me just do that. Okay, another is the depth. Yung lalim ng sugat, okay? Now the depth of the ulcer, okay, when it comes to arterial insufficiency is usually quite deep. You know what? Arteries kasi are deeper than veins, okay? So kapag nagkaroon ka ng ulcerations caused by arterial insufficiency, it can even affect the joint and even the bone. Okay? Ang pangit ng itsura kapag arterial insufficiency. Kapag naman venous insufficiency, it's very superficial. Doon lang sa, mababaw lang in Tagalog. Okay? Next, shape. The shape of ulcerations in arterial are quite circular. Alam nyo, meron pa nga silang parang, alam mo yung, parang ito yung sugat, then para siyang may wall. Okay? So, ganun yung characteristic niya. For venous insufficiency, it's quite irregular. Okay? Jagged. Okay? May part na parang pagaling na, may part na medyo ulcerated talaga, may part naman na parang discoloration lang sa skin. So, ganun siya. So, it's very really hard to identify which is the extent or to what extent the ulceration is. Okay? Unlike, again, arterial naman, kitang-kita siya. I'll show you an image later. Now, the base, ito. If it's arterial, sabi ko nga, malalim yan. It could be pale to black and there is what we call as dry gangrene. Okay? If it's venous, there are granulation tissues. So you can see na parang it's healing. Okay? It's healing. So that's venous insufficiency. Okay? And lastly, okay, let's talk about edema. Meron bang edema o wala? Okay. Kapag arterial, it's very minimal, okay? It's not common to have edema. Pwedeng wala. Pwedeng kung meron man, parang di mo rin ma-identify it's really edematous because it's very minimal. Unlike for venous insufficiency, edema is moderate to severe. Edema is moderate to severe. Okay? Bakit? Kasi there is already third spacing. Okay, kadalasan yan kapag venous insufficiency, ang dami ng blood na nandun. So, they will try to find areas, okay, sa paligid because there's too much already in the blood vessel. So, that's why it can immediately lead to edema formation. Okay? Yan. So these are the ulcerations. Okay, look at this area. Okay, hindi man siya perfect circle, but you can see it's not as irregular as this one. Then look at that. Iba yung itsura nito, iba dito, iba dito. Okay, iba-iba siya, di ba? So that's really venous ulcer. Then it's again very superficial. It's not as deep as this. Ito nga, makikita mo pa minsan may pagka-yellowish or red kasi that could be the muscles, it could be the joints. Okay, so yun na yung nakikita natin. Then you have mixed etiology. Ito nakita mo ang characteristic niya, very arterial. Then itong ibang part, yan, very venous naman siya. Okay? Again, sabi nga natin, we are dealing with peripheral vascular diseases. Ano? Now, let's talk specifically about arteries. Okay? We have the peripheral arterial diseases. So again, we have arteriosclerosis, okay, which is usually the cause, okay? Arteriosclerosis is the thickening or hardening of the arterial wall. And then we also have atherosclerosis. Atherosclerosis is a type of arteriosclerosis. So in short, all atherosclerosis are considered as arteriosclerosis. But not all arteriosclerosis are atherosclerosis, okay? Now, atherosclerosis, di ba, nandyan yung formation ng atheroma. Si atheroma, no? Okay, yung isa sa mga nasa registrar. Joke lang. Okay. Roma. Okay, so you have the atheroma. So there is the formation of plaque within the arterial wall. So it's not just it loses collagen, so making it less elastic, no? It's not just about it being thickened or hardened, but it could be because of other forms and other reasons, diba? Bakit nagkakaroon ng thickening? Bakit nagkakaroon ng hardening? Pwedeng plaque, pwedeng old age, diba? Talagang nawawala na yung collagen. So there are so many other reasons. Now, what happens in these peripheral arterial diseases is that there is vascular damage, so therefore it leads to the inflammation sequence, okay? And then you have the formation of the plaque, the fatty streak. Habang matagal siya nandun, hindi naman nalalabas, hindi nagagamit, then it can just simply lead to plaque. Okay? So, ganun ang ating peripheral arterial diseases. Okay? Wait lang. Okay, okay na ba siya? For a while, nawala siya, nawala. Okay, yes. So, nasa na ako? Here. Okay. So, sorry, nagkaroon lang ng konting problem. So, we have the peripheral arterial disease classifications. Okay, so, sabi nga natin, there is problem with circulation. So, it could be an inflow obstruction. Kapag sinabing inflow obstruction, it involves the distal end of the aorta and the common internal external iliac arteries located above the inguinal ligament. So this is the inflow problem pag nandito siya. So, okay. Yan, inflow. Okay? If it's outflow naman, it involves the femoral, popliteal, okay, femoral, popliteal, and tibial arteries. Okay, so it's lower, okay? So yun ang outflow obstruction. Again, you have the inflow obstruction and you have the outflow obstruction. Okay, for a while. Now, ano nga ba ang cause ng PAD? Okay, so sabi nga natin, number 1 dyan, kaya na-discuss natin to kanina, Diba, number one reason for these peripheral arterial diseases is atherosclerosis. And what causes atherosclerosis? What predisposes a person to atherosclerosis? So, syempre, individuals with hypertension, hyperlipidemia, so there is increased lipids in the blood. Okay? Your diabetes mellitus, those who are smoking cigarettes, ayan, obese, and of course, those with familiar predisposition or it has something to do with genetics. Okay? Kaya di ba isa rin sa mga tinatanong kapag tag dito ng family history is the presence of arterial diseases. Kasi ito also has familial tendencies. Okay? Again, anong mga characteristic ng pain kapag PAD? As we have mentioned, intermittent claudication. It usually affects the muscle nearest to the source of obstruction. So it could be, it's not just problem with the foot, no? It could be pain on the thighs, the calves, okay? Pain on the muscles, the lower leg muscles, habang ikaw ay nag-exercise. And hindi lang exercise, even when simple activities such as walking, running, and jogging, if it caused you too much pain, then it can immediately go away upon resting. It could be because of intermittent claudication. Okay? Then, in some cases, there can also be rest pain. Pag sinabing rest pain, wala ka nang ginagawa but still it's painful. Okay? Now, kapag ang problem ay inflow, usually you can experience the pain and discomfort on the lower back, the buttocks, and the thighs. Okay, that's usually the site of pain kapag may PAD. Okay, I hope you are not hearing the dogs. Okay, if it's an outflow disease, then there can be the burning or cramping of the calves. Dito yun sa lower leg, di ba? The ankles, the feet, and the toes. Okay, so sobrang sakit niya. Okay? Yan. What can we, how can we assess? What are the other changes associated with PAD? We know that if you lost hair on your lower calf, okay, and foot, then there is the dry, scaly, dusky, pale, or mottled skin. And thickened toenails, ayan, that can be an indicator of problem with circulation. Circulatory problem yan, okay? So, it can indicate PAD, but not all the times, okay? If the extremity is quite cold, it becomes quite cyanotic or color blue, there is paleness, okay? When the extremity is elevated, okay, then it can be peripheral arterial disease. Sorry, I have to my eyes, Makati. Okay? Yan. Then, of course, diminished or absent peripheral pulses. Okay, sabi nga natin, di ba, pag diminished talaga, artery. Okay? Diagnostic. So, how would we know if it's PAD? Syempre, we can do arteriography. Arteriography will help us, syempre, view the outlines of the vessels. Diba? So nakikita natin if there is an obstruction or if there is narrowing of the blood vessel. If there is narrowing, then we can identify that's the site of the atheroma. Okay? Or syempre kapag lumiliit yung there is narrowing of the vessels, again, another indicator na yun yung nandun yung obstruction. So it's easier for us to manage and to identify the best management for the client. You have the segmental systolic BP measurement. Pag segmental systolic BP measurements, we are actually checking the blood pressure in different areas of the body. Okay, so tinitingnan yung BP hindi sa upper sa lower extremity. So magte-take ka ng BP sa hita, saka sa leg. Okay, alam niyo ang idea lang naman nun, syempre you must have a different BP cuff, okay, kasi maliit yung para sa arms. May nabibili talaga na very specific for the legs, okay, so syempre it's quite bigger, and then the same principle will follow. Okay, kung paano ka mag-take ng BP sa arm, yun lang din siya. So instead na yung ano, so yung arm mo, yung thigh mo yung lalagyan mo ng cuff. And then the same, you find the nearest pulse, okay? Then yun yung pakinggan mo for you to get the BP. Pero bakit mo papahihirapan yun? There is also a machine naman who do segmental systolic BP measurements. Okay? You have the ankle brachial index. Okay, so this is actually a computation that will help us identify ano yung or if meron bang significant findings yung inyong segmental systolic BP. Then you can also do exercise tolerance testing. So under controlled environment, the client will just exercise as to what extent yung kaya niyang mag-exercise without feeling pain or yun, yung hindi magkakaroon ng discomfort. Okay? What are the interventions? Siyempre, we just need to promote proper circulation. So exercise is one good management. Siyempre, we have to promote arterial circulation and of course, vasodilation. Kaya usually in these cases, we ask them to avoid cold environment. And then since we are promoting not venous circulation, we are promoting arterial circulation, we should refrain from raising the legs above the heart level. Kasi it will be harder for the blood to be pumped up to the artery. Tandaan, ang problem natin dito is arterial circulation. So kapag itinaas mo yung paa mo, the flow of the blood is going away from the heart. So kapag mataas yan, mas lalong mahirapan ngayon yung blood na umakyat. So anong best from dito? Flat on bed lang. If not, mas mababa dapat yung extremity sa heart. Okay, para mas makacirculate yung blood dun sa area na yun. Okay, ma'am, bakit yung iba tinataas ang paa? Itinataas ang paa kapag ang problem ay venous. Kasi you are supporting venous circulation. Kapag venous circulation, saan ang flow ng dugo? Mula sa dulo ng daliri ng paa mo papunta sa heart. So pababa siya. Kapag tinaas mo, bababa, mapopromote mo ang venous circulation. Pero ang arterial circulation, ang ano niyan is pataas. Okay? Kaya dapat proper positioning. Okay? Tandaan yan ha. Kaya it's better for us to identify if it's arterial or venous. Because one action for this one may not be the recommended action for the other one. Okay? Tandaan yon ng maigi. Now, we also have to avoid crossing the legs, refrain from wearing restrictive clothing. Ma'am, di ba? Pwede naman. Again, the problem is with the artery, not with the veins. So kahit na yan pa ay yung pinakamahal na tawag dito, anti-varicose stockings mo, hindi siya effective dito. Because what we are promoting must be the circulation of the artery. So kapag iniipit mo siya, it'll be harder for the blood to flow into the lower extremities. Okay, tandaan yun. Then again, we provide warmth. Nasabi ko na to kanina na we avoid cold environment and we always provide warmth. Why? Because it also promotes blood flow at the same time, it promotes vasodilation. So vasodilation, di ba? The pressure is it's quite lower kasi dilated yung vessels mo. Okay, so that's what we want. We avoid cold because cold temperature causes vasoconstriction. And again, at this point, if your patient is suffering from PAD, we would like to always promote proper circulation of the arterial blood. Okay? Now, definitely, you must avoid emotional stress, caffeine, and nicotine because it is scientifically proven, okay, to alter blood circulation. And again, at this point, we don't want the blood circulation to be out. Okay? Now, pharmacologic interventions. Yan. We give them pentosyphilin, okay, or Trental. Alam niyang ginagawa niya, it makes the blood, parang it helps the blood to flow easily into narrow spaces. Ibig sabihin nga, di ba? It increases the flexibility of the RBCs. It also decreases viscosity, making arterial blood pass through narrow vessels. Okay? So, pentoxifillin is actually a form of hemorrheologic agent. Ano ba yun? Double R. Sorry I think it's double R. Rheologic. It's a hemorrheologic rheolo. Oh, yun. Rheologic agent. Ibig sabihin, it makes blood flow easier. Okay? So it helps the blood to flow more easily into narrowed arteries. So remember, ang problem natin dito is with circulation. Then, of course, you can give them blood thinner. Diba, aspirin is matagal na siyang ginagamit talaga. It is a scientifically proven effective na tawag dito, blood thinning agent. Okay, so syempre, if the blood is thin, then it's easier for the blood to actually flow into narrowed spaces. So surgical interventions, of course, you have PTCA or percutaneous transluminal angioplasty. Now, this is an invasive procedure. This is where arteries are dilated using a balloon catheter. So, yan. Nag-insert ka ng catheter, then nag-inflate ka ng balloon. Anong ginagawa niya? It pushes the plaques on the sides. So, anong ginagawa niya? Ito dati yung diameter niya. Dahil dun sa ginawa mo, lumaki ngayon yung diameter ng blood vessel. Okay? So basically, it's a condition or it's a procedure that keeps the vein open. Now, in some cases, nag-iiwan pa ng stent. Diba? Para kapag na-push na niya, parang meron siyang support. Para yung chances na siya ay mas magkaroon pa ng obstruction, at least meron ka ng stent na naiwan doon. So again, it's the decision of your client. But basically, the condition is to really push what is causing the occlusion, okay, to the side for easier blood circulation. Next, another is laser-assisted angioplasty. So ito naman, ayun, ibinivaporize yung mga atherosclerotic plaques. Okay, so tinatanggal yung mga atherosclerotic plaques, sinusunog. So syempre, kapag nasunog yun, so the blood can easily flow na. Okay, so that is laser-assisted angioplasty. Okay, plasty means repair. Okay, then hindi may iwasan, we can also do bypass procedures. Okay, so kung nandito ang obstruction, you will bypass the obstruction. Gawa ka ng bagong dadaanan ng blood. Okay, so kapag talagang lahat ay sinubukan mo na and still hindi pa rin siya effective, so we do bypass grafting. So ang bypass hindi lang sa heart nangyayari. Ang bypass pwede rin gawin sa mga blood vessel. Basta anong idea ng bypass? To bypass yung tawag dito, yung obstructed na artery or vein. In this case, artery. Okay, artery to. Sorry. Pero ma'am, bakit color blue? Artery yung may problem, pero ang nilalagay natin is actually a vein. Okay? Ang nilalagay natin, kadalasan in most cases talaga, is sa venous vein. The great sa venous vein. Okay? Pwede rin naman ang cephalic, pwede rin basilic artery or arm ng veins. Pero the best would always be the great sa venous vein. Okay? Next. Okay, you have Buerger's disease or thromboangiitis obliterans. Okay. Other term for Buerger's disease is thromboangiitis obliterans. Okay, so this is Buerger's disease. This is again another condition naman, pero again, the arteries, okay. However, it usually affects small arteries, and also veins. Ibig sabihin, hindi na siya yung katulad kanina na it affects the leg. Now, this usually affects the digits, okay? Usually, fingers na yung makikita natin yung mga manifestations nito. So it's the recurring inflammation of the intermediate and small arteries and veins of the lower and upper extremities. Okay? Ayan. Ayaw niya na mag-move. Okay. So, this is how it looks like. Ayan. So, usually may obstruction ng mga vessels, pero it's usually smaller. Kaya nga sabi ko nga it affects the digits, so the fingers or the toes. Okay? So, what are the risk factors, okay, when it comes to the development of Buerger's disease? First, common among male young client. Ikaw ba yun? Okay. Next, those who are smoking cigarettes. Okay. Actually, you can see one of the pictures of those suffering from Buerger's disease. Di ba ngayon, ano na, yung packaging ng mga cigarette ngayon may ano na may image na, 'di ba? Then meron sila doon kapag yung nakita niyo yung sa kamay tas parang nabubulok. Yun, it's actually Buerger's disease, okay? Pero tandaan natin, the cause is usually unknown. So in most cases, idiopathic talaga ang Buerger's disease. Now, not one can even identify na ito yung definite cause niyan. We only have the risk factors, but we don't have the definite cause of Buerger's disease. Okay? Now, what are the manifestations of Buerger's disease or Buerger's disease? Okay, sa iba it's Buerger's. So, well, ako, I would like to call it more as thromboangiitis obliterans. Diba? Mas magandang pakinggan. Okay, so anyway, there can be pain. Okay, the pain of thromboangiitis obliterans is in-step claudication. So, there is pain on the arc of the foot. Okay, pain on the arc of the foot. Okay, upon walking. Masakit siya. Okay, yan yung arches. Okay? Yan. In-step claudication. So, di ba kanina intermittent claudication can affect the muscles of the leg, the muscles of the thigh. Okay, dito, it usually affects the instep. Okay, yung, again, sabi ko nga yung arc ng paa. Digital rest pain. Masakit ang daliri, wala namang ginagawa. Okay? So there can be yan, chilling or tawag dito, yung tingling sensation, okay, ng mga fingers. Now, it can be aggravated by emotional disturbances, even by nicotine, di ba? Nag-i-smoke sila, maramdaman nila parang may pagkamasakit doon sa kanilang kamay, fingers. Okay? Or chilling kapag masyadong malamig. Why? Because vasoconstriction. So, kung obstructed na siya, then constricted pa, so mas nagkakaroon ng problem sa blood flow. Kaya kapag malamig, usually mas sumasakit siya. Okay? There is increased sensitivity to cold. Okay? There can be dependent rubor. Ibig sabihin, if the patient is lying on their left side, kumbaga, then the left side is actually quite red. Okay? So that's dependent rubor. There can be absence or diminishing radial or ulnar pulses. Again, common to sa kamay. Okay kasi. Kaya, so the nearest pulse. Then there can be digital ulceration or gangrene. Kita niyo naman sa image, di ba? Ang pangit. Yan. Okay? So, yun. Now, how can we diagnose thromboangiitis obliterans? So, you have segmental limb blood pressure. Nabanggit natin to kanina sa peripheral arterial diseases. Di ba? You can also do duplex ultrasound sonography. Okay. By the way, segmental limb blood pressures, we take it on different parts of the extremities. Okay. So if the upper extremity is affected, we do it on the upper extremity for us to identify where the obstruction is located. Okay. If it's the lower extremity, then you have to do it on the thighs and the legs. Okay. Duplex ultrasonography. So yan, you are also measuring naman kasi yung flow ng blood. You are detecting, let's say, problems with blood flow. Okay, makikita nyo kung may obstruction. Then we also do contrast angiography. So contrast angiography, so katulad nito, mansin nyo, may part na nawala. Okay, may part na nawala. So ibig sabihin, hindi naka-flow ang blood dito kasi maaaring meron siyang obstruction. 'Di ba? So, yan yung mga pwede nating gawin for our client. Now, what would be our intervention? So, well, if they experience this, syempre, we always advise abstinence from tobacco in all forms. First, it increases the risk of developing Berger's disease. Okay, di ba? It's a no-brainer. Alam na natin yun. Syempre, tumigil sa paninigarilyo. Another thing, di ba, nicotine also stimulates pain, okay, among these clients. Kasi nicotine is also a vasoconstrictor. So, kaya, as much as possible, tanggalin na nila. Kasi the chances of obstruction ng blood flow is very high. So, nakikita nyo to, akala nyo nasunog lang, di ba? But those are actually necrotic tissues. Those are already dead tissues. Okay, dead tissues na yan. Di mo na kayang i-revive yan. Okay, so, ang mangyayari dyan, you have to remove it, di ba? Kasi it can lead to gangrene. It can be infected. It can be source of sepsis and all. So kaya usually tinatanggal na yan. Pinuputol na. Another is avoid extreme exposure to cold. Sabi nga natin, cold promotes vasoconstriction. So kapag lagi ka naka-expose sa cold, so again, the blood flow will be quite difficult. Okay, so kaya we avoid prolonged exposure to cold to also avoid vasoconstriction. Okay, next, we have the Raynaud's phenomenon. Now, the Raynaud's phenomenon is quite interesting kasi if you can see, iba yung kanyang characteristic. Okay, sorry, I'm looking into the presentation kasi kung ilang slides pa. Okay, so far, at this point, we still have 20 more slides to go. Okay, so keep up with me. Now, Raynaud's disease, it's caused by vasospasm. In short, it's not actually an obstruction, but it is a spastic blood vessel. Okay, so spastic, di ba kapag nagkakaroon ng spasm, nagkakaroon ng constriction. And that usually causes, of course, problem with circulation. Okay, so yan, there is constriction of small blood vessel and it leads to Raynaud's phenomenon. It's phenomenon because, ayan, nagiging white siya. Okay, and then kapag matagal, magiging blue na siya. Then kapag na-warm up na siya, nag-vasodilate na siya, bigla siyang mamumulan na. Okay? So yun. Pero ang pinaka-significant talaga kapag sinabing Raynaud's phenomenon would be the white, the paleness of the digits. Okay? Yan talaga yung pinaka hallmark characteristic ng Raynaud's disease. Okay? There is the blanching of the extremities. Okay, followed by cyanosis. So namumuti siya muna, kita naman. And then after a few minutes, nagiging parang blue na siya. And then you promote vasodilation, you put them in warm temperature, biglang mamumula naman siya because the blood will go back. So it's quite, again, it's quite difficult to comprehend what causes that, no? Sabi nga, it's just vasospasm. But really, they can pinpoint out what could cause this vasospasm. Ang nakikita lang would be, syempre, malaking predisposing factor would be the environment. Okay, if it's very cold. Kadalasan yun. Because cold again causes vasoconstriction. Very good. Okay. Now, the Raynaud's phenomenon, again, there's the blanching of the extremities followed by cyanosis. Then, clients may report numbness, coldness, and pain in the area. In some forms, pwedeng magkaroon ng swelling, pero very rarely pwedeng magkaroon pa rin ng ulcers. Okay? Pero again, it's not as common as Berger's disease. Yung ulceration sa Raynaud's. Okay? Now, what do we do in Raynaud's disease? First, syempre, ang problem lang dito is vasoconstriction. So if the problem is vasoconstriction, by principle of maintaining homeostasis, kapag nag-constrict, dapat gawin natin, i-dilate natin. So that's why we can give calcium channel blockers because these calcium channel blockers will actually cause vasodilation. So it will send a signal to our blood vessel to dilate, whether or not it's malamig or not, pero it will follow the instruction of the blood, of the drug. So it will dilate. Okay, and the first drug of choice for Raynaud's disease is nifedipine. Okay, that's the first drug of choice. Then in worst cases, lalo na kapag paulit-ulit na siya, we actually do sympathectomy. Mama, anong ginagawa dyan? Sympathectomy is a minimally invasive procedure. Okay, so ganyan lang yan. Dito lang sila maghihiwa saka dito. So sobrang mabilis lang siya. Okay, pero ang gagawin niyan, i-cauterize kasi yung sympathetic nerve. Why? Because another thing, apart from vasoconstriction, one event, okay, that happens in Raynaud's disease is the overreaction of the sympathetic nervous system. Okay, and they say that's the reason why continuous yung vasoconstriction niya. It's because of the overreaction by the sympathetic nervous system that it's very hard to bypass. So kaya kapag yon yung na-identify na main problem, so they do sympathectomy. They will cut off portion of the sympathetic nerve so that it will not send unnecessary signal to the digits or to the hands in that case. Okay? So, yun ang Raynaud's disease. Well, I hope you are still with me and I hope you are still listening. Next, we have venous thromboembolism. Okay. Now, first, let's differentiate terms just for us to set the mood for this discussion. We have the words thrombus, embolus, thrombophlebitis, and phlebothrombosis. Now, these are 4 different concepts. Hindi sila pare-pare. Okay? These are 4 different concepts. Now, when we talk of thrombus, ayan, meron tayo ditong, ito yung mga characteristic niya. It could be because of endothelial injury. It could be because of venostasis, or it could be because of hypercoagulability. Diba? That's what you call as the virtuous triad. Okay, so for a while, sorry, kasi I have to save yung tablet. Yun kasi yung ginagamit ko ng pang note. Okay, siya ay nag-notify na malulobat na daw siya. Pero nanandang 30 seconds para i-charge. So I hope it's already charging well. Kasi 'di ba, madaling mag-discuss kapag medyo nakakapag-sulat-sulat ako sa screen. Okay. So again, these are the 3 conditions present, okay, for thrombus to happen. And this is what we call the virtuous triad. If there is endothelial injury, venostasis, hypercoagulability, then there can be thrombus. Another is embolus, okay? Pag sinabing embolus, this is a blood, it could be a blood clot, it could be an air, it could be a fat, that is moving. You have the word moving from its place of origin, and it can obstruct the circulation in the blood vessel. Okay, so that is an embolus. Okay? Nagmo-move siya. Now, when we talk of thrombophlebitis naman, it is thrombus that is associated with inflammation. Again, tandaan nyo you have your itis. Phleb pertains to the blood vessel. Thrombo, it pertains to thrombus. So, ibig sabihin, it is thrombus that leads to the inflammation of the blood vessel. Thrombophlebitis. So, merong thrombus, kaya nagkaroon ng inflammation ng blood vessel. Last, we have the phlebothrombosis. Phleb, you have your blood vessel. Then you have the word thrombosis. So this is a thrombus. However, there is no inflammation. Tinanggal natin na yung suffix na itis, di ba? So that is phlebothrombosis. Okay, now let me just show you some image that will illustrate all of these four. So this is a thrombus. As you can see, there is that collection, in this case, of blood cells. Okay, so this is technically a blood clot. But it is not mobile. It's not moving. It's quite static. Static lang siya. Pag sinabing embolus, nag-detach na siya. On the move na tuloy siya. Embolus na yun. Gumagalaw na siya, kasama na siya ng blood circulation. Then it can lodge on any parts of the body. Diba? Pag embolus, pwede yung mag-lodge. Kadalasan, ang site ng kung saan sila natatrap ay sa lungs. Diba? Kaya, isa sa mga complications ng mga ganito would be pulmonary embolism. Okay? Thrombophlebitis. You can see there. Diba? Ang laki nung vessel. Ayan o. Then there is inflammation. Okay, you can see it is actually inflamed. Okay, baka kung akala nyo kung ano yung drawing ko dyan. Okay, and lastly, have thrombus. Ayan. Okay, pero it's not inflamed. It's not inflamed. So, yan ang mga i-discuss natin ngayon. Okay, first, let's have deep vein thrombosis or DVT. Okay. DVT, so there is thrombosis in the deep veins, and usually that's the leg veins. Okay. Now, the most common risk factors for DVT would be those who have undergone hip surgery, those who have undergone total knee replacement, ayan, prostate surgery, pregnancy, ulcerative colitis, heart failure, immobility. Now, there are so many things pa. Pero tandaan, if you can see, bakit ma'am ganito? Kasi it poses a risk when it comes to the presence of blood, bleeding, blood clots. Okay? It could be because of, let's say, a fat that went out of the marrow during a hip surgery. Okay? So, prolonged lying down, yan yung mga pwedeng, very static yon. Tandaan nga natin static. Diba tandaan nga yung virtuous triad. Okay, if there is endothelial injury, if there is stasis, and also if there is, tawag dito, ayun, let me go back. Ayan, kasi, ayan, venous hypercoagulability. Sorry, kasi it's actually too late na. Okay? So, yun. Next, yan, the risk factors. Next, we have the assessment. Okay, how do we assess client with deep vein thrombosis? Okay. So, syempre, there can be, no, not yet. Okay, yan. So there can be calf or groin tenderness and pain and sudden onset of unilateral swelling of the leg. Okay, may namamagang isang part. There can be edema, localized edema in one extremity, and that can already suggest thrombophlebitis. Okay, yung iba, ito sabi nila, the hallmark sign of DVT is Homan sign. Totoo naman, no? Homan sign, kapag positive ang Homan sign, DVT yan. chances ng DVT sobrang taas. Pero minsan kasi, it's quite misleading. Bakit ma'am not advised? Kasi, do you know that only 10% of individuals who have tested positive or 10% of individuals with DVT will test positive for human sign. Now, the rest is 90%. So if your basis is something that is not that definitive, then the chances of you going to another path is more likely. Kaya nga, good kung positive ang human sign. Alam mo na, DVT yan. Pero kung negative ang human sign, you must not rely on that. Because again, only 10% of clients with deep vein thrombosis will actually test positive for human sign. So again, it's not accurate at that today, okay, based on the recent studies. So it's not definitive when it comes to DVT. Again, there are many false negative results of human sign, but still the patient has DVT. So, hindi natin napansin, akala natin, negative naman human sign, DVT yan. Then after some time, you'll realize mali ka pala. It's really is DVT. Negative lang siya sa human sign. So, human sign is actually a test that we use na hinahawakan natin yung dito, yung leg, and then we are actually dorsiflexing the foot. Ito yon. Yung dorsiflex natin. Then, ibababa natin yung knee, masakit siya dito. If there is pain or discomfort in the calf, that is positive human sign. It can be DVT. But again, if it's negative human, don't be happy. Okay, there can be other tests that needs be done because again, human is not definitive. Negative human will not tell you that the patient has no DVT. Okay, so tandaan yun. Other test, okay, which is much more definitive, okay? So kaya nawag na gold standard, ibig sabihin, ito yung talagang sinasabi nga natin na very accurate when it comes to testing for DVT is contrast venography. Diba? Check yung vein. Tingnan nyo naman to, oh. Alam mo na may obstruction. Ano kaya ang obstruction niyan? So definitely there can be a thrombosis on that area. Okay, so kaya gold standard is contrast venography because you can really see the outline of your blood vessel. Now you can also do ultrasound, okay, Doppler flow studies, impedance plethysmography. Okay, ang impedance plethysmography, it actually uses electrical monitoring. Okay, it measures the blood flow of the veins of the leg. Okay, so it will really help you identify if there is deep vein thrombosis. Then of course, MRI. Okay, but again, among all of these, let's stick with the gold standard. Okay, kasi scientifically proven to be effective in identifying the presence of DVT among clients. Okay. Next, we have, deep vein thrombosis, so management natin. So our focus of treatment is to prevent possible complications, okay, such as pulmonary emboli, okay? So kasi syempre yung thrombus, di ba pwedeng ma-dislodge, pwedeng maging emboli yan. At kapag naging emboli yan, pwedeng pumasok yan sa lungs, okay? And that can cause pulmonary embolism. So that's why our goal is to prevent embolus, yung maalis siya. Kaya nga, nakalagay dyan, do not massage the extremity. Bakit? Kasi when you massage the extremity, para bang nilulusen mo yung thrombus niya. Nilulusen mo yung thrombosis. So, pwede maging emboli siya. Mas fatal kapag siya ay naging emboli. So, kaya our goal here is to prevent further thrombus formation. Iwasan na nating lumaki siya. And supportive therapy. Okay, we actually give them drugs para tawag dito, para matunaw, okay? Ma-disintegrate yung thrombus without causing an emboli. Okay? So, yun. Supportive therapy, bed rest, and elevation of the extremity just to promote venous circulation. Okay, kaya kasi, tandaan, di ba, virtual triad, there is stasis, endothelial injury, and hypercoagulability. It happens usually kapag laging nakababa yung paa. Okay, kaya dapat tataas para yung flow dire-diretso. Okay? Management of DVT will include anticoagulants. So you have the use of unfractioned heparin. Pag sinabing unfractioned, that means raw. It's not separated, it's not crystallized, it's not distilled, okay? It's raw heparin, okay? So it prevents the formation of other clots, 'di ba? Sabi natin anticoagulant yung heparin. It prevents the enlargement of the existing clot, okay? So it helps dissolve. I'll just use the term dissolve, pero it also prevents yung mag-coagulate siya dyan. Hypercoagulability is part of the virtual triad. Discontinued natin if there is severe induced thrombocytopenia and thrombosis. Okay, yes, pwedeng mangyari yan. Anticoagulant, then pwede pa rin silang mag-aggregate. Pwede pa rin silang magdikit-dikit. Okay? So, kaya ang side effect niyan would also be bleeding. Antidote, if it's too much, kapag sa tingin nyo ay hindi na tama, then you can give protamine sulfate. Protamine sulfate will actually reverse the effect of unfractioned heparin. Next, we have drug therapy. Okay, so you have the warfarin therapy. Warfarin is also an anticoagulant. Okay, warfarin is a drug that works in the liver and that inhibits the synthesis of 4-vitamin K dependent clotting factor. Tandaan natin, vitamin K also promotes clotting. So, ang ginagawa ni warfarin, it prevents the action of that clotting factors. Okay? Sorry. Mababa yung buhok ko. Now, ang pangit lang, warfarin is good. Okay? Magandang effect ng warfarin. Kaya lang, it doesn't have an immediate effect. Okay? Imagine, it will even take 4 days, okay, before it could exert therapeutic anticoagulation. 4 days bago siya magkaroon ng therapeutic anticoagulation. Medyo matagal yung effect niya. Pero again, warfarin is very good. You can also give thrombolytic therapy by means of certain drugs. Yung mga tinatawag natin recombinant tissue plasminogen activator. You have your alteplase, your retiplase. Ayan. So, they are very effective when it comes to dissolving clots. So, it dissolves clots. Diba? Ang cause naman ng DVT is the presence of thrombus. So, it dissolves the thrombus without causing an embolus. Okay? Then, it also helps prevent new clots. However, the problem here, diba? So, again, tinatanggal natin yung clotting. So, the side effect would be bleeding. And the most serious complication would be intracerebral bleeding. Okay, so kaya if they are taking these forms of anticoagulants, tandaan natin, we have to protect the client, we have to protect them from injury because they will bleed much if they are taking these anticoagulants. Because all of these anticoagulants actually affects the clotting cascade of the body. Binabawasan niya yung chances na mag-clot ang mga blood natin. So, pwedeng mag-bleed sila profusely. Now, our, of course, health teaching, hindi mawawala, di ba? Siyempre, you ask them to avoid smoking. Okay? Just simply stop smoking. Oral contraceptives are also proven to produce thrombosis or thrombi. So, kaya we advise them to avoid the use of oral contraceptives. We also avoid contact sports, sabi nga natin, traumatic situations. If they are taking warfarin o heparin, kasi magdudugo sila. Konting bump lang sa kanila, pwede silang magkaroon ng pasa. Okay, konting injury lang, maliit na sugat lang, pwedeng mag-bleed siya. So, kaya here, we always have to watch out for possible signs and symptoms of bleeding, both external and internal. Kasi pwedeng magkaroon din ng bleeding internally. Okay, so that is for our DVT. Now, let me see. Okay, yes. So this is the last part. Varicose veins. Do you have this? Ako, wala pa. Okay, kayo, meron na? The varicose veins are dilated tortuous veins. I think I need not to explain because you know how it looks like. So this is how a varicose vein look like. Varicose. Diba? Dilated yung vessels. And then, usually, nakaangat pa sila. The most common site is the saphenous vein. Why? Because the great saphenous vein, yan yung vein na nandyan sa alak-alakan natin. Okay, ano ba yung alak-alakan? Popliteal area. Nandyan sa ating popliteal area. So as you can see, because our vein there do not have much support. Kasi di ba wala namang muscle dun sa mismong alak-alakan natin. So it lacks support, kaya that's the, in most cases, dyan mas nagkakaroon ng varicosities. Okay, however, it can also occur in rectum, okay, in cases of hemorrhoids or almoranas. Ayan, it can also be present on the esophagus as a form of esophageal varices. So this is how varicose looks like. Normally, di ba sabi nga natin, normally, meron tayong mga valves. Then the valves, ang nangyari, magpupush yung blood papunta dito, makakapasok siya. But the blood cannot go back at all. Diba? Hindi na niya kayang bumalik. Okay? Kasi close na siya. Now, kapag may varicose veins, makakapag-flow ang dugo doon, pero babalik siya ulit. Bakit? Kasi tingnan niyo to, oh. Ano yung ma-observe mo? Hindi na intact yung valve. So the blood, kung ikaw ay nakatayo, by gravity, the blood will flow downwards. Kung ganito ang itsura niyan, hindi na niya yan ipupush pa pataas. Kasi walang tumutulong sa paligid niya. Okay, so I hope I am here again. Nawala yung ginagamit ko kanina. Sandali lang. I'll clear all the drawings in a while. Okay, yan. So again, sa varicose veins, wala na. Okay, so dire-diretso babalik at babalik siya dyan. Iipon yung dugo dun sa site. So kaya very weak na yung walls ng vessels. Okay, so ganyan na nangyayari sa varicose veins. Okay, now what happens? Bakit nagkakaroon ng varicose veins? So syempre, it could be because of incompetent valve. It could be because of poor venous return. Or it could also be because of thrombophlebitis. Okay, ano yun? Incompetent valves usually, ayan, familial tendency. Ipinanganak ka na medyo talagang it-runs in the genes ninyo na mahina yung valve mo. So, konting pressure lang, hindi niya na kaya, bumubuka na siya, so that already promotes backflow. Or poor venous return, laging nakatayo. That's why varicose veins are common among sales lady. Yan. Kaya nga, di ba dapat yung mga sales lady naka-support stockings para may support yung, again, yung great saphenous nila, or else, pag laging ganyan, syempre, magkakaroon ng varicosity. Obesity, the same. Di ba? Pregnancy, lalo na. And of course, abdominal tumors. Because it pushes the blood downwards. Okay? So, yun. Now, it could also be because of thrombophlebitis. Because thrombophlebitis, since this is inflammation, it can actually damage the valves. Since this is inflammation, it damages the valves. Now, it can lead to venous congestion, ipon yung mga blood. Then, it can lead to distension of the venous walls. Nagdi-distend na siya, nai-stretch na siya. 'Di ba? Kaya nagiging ganito na yung itsura niya. Yan. You can see that. There are visible veins. This is the great saphenous. Okay, yan. So how do you assess varicose veins? Well, first, minsan hindi naman agad-agad kita. Pero initially, our clients will experience that continuous feeling of heaviness and tiredness. Particularly after they have stand for long. Okay? And then again, kapag itinataas yung paa, then they feel good. Okay? Now, the veins will look distended and tortuous, and it can be seen under the skin as a dark blue to purple snake-like elevations. Okay? Then their feet, their ankles, and legs may also appear swollen. That only supports poor venous return. Kasi nga hindi na makabalik yung blood sa taas, sa naiipon yung blood sa baba. Okay? So, ganun yung nangyayari sa varicose veins. Kaya rin siya kumakapal, dumadami ng dumadami. Now, varicose veins usually start as reticular veins or spider veins. So, kala mo, may spider veins ako, ganun lang yun. No, that's already the start of varicose veins. That's already stage 1. And then, you can already see varicose veins or venous nodes. Yan, nagiging visible na siya. Hindi na siya basta spider na lang, nagiging snake na siya. Okay? And then associated with edema, that's stage 3. And worse, nagkakaroon na ng ulcerations. Okay, nagkakaroon na ng ulceration. There is varicose eczema or trophic ulcers. Now, how do we manage varicose veins? That could be your question, lalo na for girls, no? Now, varicose veins can be managed by means of frequent exercise. Why? Because sabi nga natin, ang muscles, pinupush na yung blood pataas. So, if you frequently exercise, so it will push the blood upwards. Hindi siya naiipon dito sa baba. 'Di ba? So, nababawasan niya yung pressure sa baba. Losing weight, of course, kasi mas mabigat tayo, the chances of yung pressure sa baba natin be very high. Now, if you have to stand for long period of time, it is best recommended to wear support stockings. 'Di ba? Kaya for nurses, we have our nurses stockings. Hindi yung basta yung yung puti lang na nakikita nyo dyan, no? So, usually, mas, iba yung feel niya kapag sinuot mo siya. Ganun talaga yun. Kasi nursing is also a profession na lagi tayong nakatayo. 'Di ba? Then, of course, prolonged sitting and prolonged standing. Okay, bakit? Kasi, nasa dependent position ng paa, so the blood is not flowing well upwards. So, maiipon lang yung blood doon. And that can, again, weaken the vessel. Kasi lalaki siya ng lalaki. Okay? Next, we can do surgical management. Kapag talagang ang pangit na, para talagang ahas din, ang dami-dami nila, then you can do vein ligation. So the veins are tied off above and below the area. Then you remove the veins with incompetent valves. Okay? Yung mga incompetent valves, tatanggalin na. Pero yung mga nag-work naman ng maigi, so iiwan lang siya. You can also do vein stripping. To ginagawa to sa mga tawag dito, sa mga aesthetic clinics din. Pare-pareho naman sila. So the veins are then ligated, severed, and removed. Diba parang ahas. So tanggalin mo isa-isa, tanggalin mo, then i-stretch mo, pagdikitin mo silang dalawa. So nawala na yung part na very edematous. Okay, yun yung vein stripping. And then, ito naman ang ginagawa sa mga aesthetic centers. Okay, sclerotherapy. Sclerotherapy, may i-inject ka dun sa vein. So there is a chemical that will be injected in the varicose vein, and then it will scar and it will close it. Okay, ganon ang sclerotherapy. Okay? And then lastly, syempre, what would be our post-op nursing management if the patient have decided on undergoing such surgical therapy? So first, syempre, we always have to assess the skin. We assess for distal circulation. So to check natin yung nail beds, definitely. Diba? You observe for peripheral edema, you assess for pain, yung typical na assessment procedure. Now, post-op, syempre, we have to look into possible swelling of the site. Okay, and then usually after the procedure, binilalagyan niya ng roller bandage. That's to promote pressure on the area. Okay? So, tinatanggal yun for a while, then ibabalik ulit just to facilitate blood flow. Okay? Then of course, don't forget to assess for the signs of active bleeding. And then immediately post-op, pwedeng i-elevate yung foot ng bed just to promote venous circulation to the heart. Pwedeng gumamit ng tinatawag nating Trendelenburg position, yung mas mataas yung paa kesa sa heart. Nakaslant siya pa ganun. Okay, so those are the things that we can do in assessing these clients and managing these clients with varicose veins. So this is the end of my discussion for peripheral vascular disease. I hope you learned something today. Okay, after this, you have to take the quiz, which I will be publishing. Yes, there is a quiz. Okay, so just look on your canvas. I will be publishing the quiz regarding PVD. That's it for this day. I hope you learned well. Feel free to ask questions on our chat box. If I am not your instructor, if you are part of Dr. Areglo's class, you can ask your class president to direct the question to me so we can answer it on our GC. Thank you, everyone, and God bless. I'll see you all next time. I'm sorry I haven't met you yet. Thank you.